Doctor on Demand is a BMA ally for many reasons. I want to focus first on the word better. When I decided to join Doctor on Demand 8 years ago, I was really focused on helping to make healthcare better. That was the opportunity, that was the mission. And when I think about Better Medicare Alliance, I think that is what BMA is absolutely doing. If you think about access to care, BMA has been able to increase access to care to millions of Americans. I think somewhere close to 26 million Americans now have access to a Medicare plan through a Medicare Advantage carrier are offering. And this is really incredible. This is making care accessible, not just to patients who are in rural areas, but that is extremely important. And that is something that a telemedicine platform like Doctor on Demand is also able to offer. But they're also increasing access to care in primary care deserts or areas that are urban, isolated areas. So this is also incredibly important and an important part of our patient population that needs to get access to care. So the access portion is really important, but the other part about this, I think, is the accessibility. So we are strong allies, and I would say very aligned, because we are seeing increased accessibility to care. And what I mean by that is patients from all of these different regions of the country and geographic areas and demographic groups, as I was describing, whether they're coming from an urban area or a rural area, are actually being able to find accessible care that actually is providing a better patient experience. So there's access, and then there's accessibility. And part of accessibility, I think, is making sure that you have high client or patient satisfaction levels, so the patients actually are experiencing healthcare in a different way or in a better way. The importance of Medicare Advantage to a practice like Doctor on Demand is really the potential for innovative plan design. We've already seen and partnered with various MA plans to develop virtual first healthcare plans that allow patients to access virtual care. And then also newer plans that hybridize actually between virtual care as a complement to traditional brick and mortar. So these are really important innovations that I think we've all seen, given the pressures and limitations that COVID-19 placed in our traditional healthcare system. We really need new and innovative platforms to allow for care delivery to occur efficiently. The other really big advantage of Medicare Advantage, though, is that there is no originating site requirement for virtual care practices. This, I cannot stress how important this is. If you look at traditional Medicare, prior to COVID, you would require an originating site encounter, which means a patient has to go in person to a site of care, like a clinic, to be able to access their clinician through a virtual care encounter. And so this is something that Medicare Advantage does not require. And because of that, when COVID hit, we were able to offer Medicare Advantage members these virtual care visits, whereas traditional Medicare fee-for-service had to actually produce a waiver. They were able to their credit, they were able to do that very quickly. But I think COVID really demonstrated the true advantage of the Medicare Advantage model, which really allowed for this type of innovation and quick conversion to virtual care visits for patients who really needed that care. So I think this is extremely important that we really do our diligence in assessing the models, and that we allow the Better Medicare Alliance and the Medicare Advantage plans to continue this innovation. It's just so needed for where we're going and for what our population needs and what our nation needs in terms of care delivery. Future of Medicare Advantage for me is really a personal one, actually, because one of the impressive statistics that I saw was that there's an increased diversity in the patient population of Medicare Advantage members. So I think 1 in 3 Medicare Advantage members is a Black Indigenous person of color. So someone who is basically a minority or non-white individual who is actually receiving care. And that's a higher percentage of the population of Medicare Advantage than the general fee-for-service Medicare population. So The practice at Doctor on Demand is 43% our clinicians, 43% of them are Black, Indigenous, people of color. We have a mandate to improve access to care and accessibility to care, but doing so in an equitable way. And so that includes reaching out to marginalized groups, whether they're people of color or LGBTQ plus populations. And so I think that Doctor on Demand and BMA are aligned on making care more accessible, but also more equitable. And that's just something that, as long as BMA is willing to keep working on that for the future, and so is our organization.